Back this morning, a measles warning is growing here in Georgia, with state health officials now confirming 3 new cases. So this brings the overall tally for our state up to 5. In all of last year, Georgia reported 10 confirmed cases, and these new cases are from one Metro Atlanta family, and state health officials say the family was not vaccinated and had recently traveled internationally. Georgia's case count is still small, but this is happening against a much bigger national backdrop. The CDC says there have been 27 new measles cases outbreaks reported in 2026. Now health officials are working now to track down anyone who may have been exposed after they returned home and developed symptoms. This morning, we're asking what families need to know right now with Ben Lopman, professor of epidemiology, global health, and environmental health at Emory University. Glad to have you on with us here streaming this morning. So when people hear 5 cases, they may think that still is small, but why does even a small number of measles cases really get the attention of public health officials?
Yeah, thanks so much for having me to talk about this. So, these cases are not a reason to panic, but they really are a reason to pay attention to what's going on. And Georgia has, as you said, a relatively small number of confirmed measles cases. But the reason that measles is so concerning is that it can move fast. It's one of the most infectious viruses that we deal with. The cases that have been observed so far, that have occurred so far in Georgia, they fit a typical pattern of unvaccinated individuals who often have international travel to an area where measles transmission is occurring. They get infected and they bring the virus back, and that seems to be what's happened in this case. And the Georgia Department of Public Health will have snapped into action now to identify people who've potentially been exposed and to monitor them for the appearance of ongoing cases.
You mentioned that measles is different in a way that it moves faster than some other illnesses and viruses. What makes measles different in other ways, compared to other viruses that families may be used to hearing about?
Yeah, well, it's extraordinarily infectious, and that's why we have to be so careful when cases do occur. It spreads through the air. It can hang around in the air or on surfaces for even hours after an infected person has left a room, for example, where they've been. So it's really highly infectious. It's also it's on the more severe end of the viruses that we deal with and that can infect people. But fortunately, we have a highly effective vaccine that really offers the best protection. The MMR vaccine is kind of what is the best way for people to stay safe, to stay uninfected. But when this virus finds pockets of unvaccinated people, that's when it can spread.
Yeah. So the family that we mentioned earlier in the Metro Atlanta area, they were not infectious during their travel, but officials are now checking for exposures after they got back. So what does the contact tracing look like for measles?
Yeah, this is what health departments do. This is the kind of bread and butter work of on the ground public health work that the Georgia Department of Public Health and other agencies are engaged in right now. They identify people who have been exposed, who have been in contact with the potentially infectious individuals, and they'll put in a protocol to monitor those people and assess them for signs of infection. So obviously, this is a health concern for the people who've been infected. It's also a kind of major, economic impact. It requires a lot of resources for the public health department to respond to measles outbreaks. So we're grateful we have them to help us in these situations.
Got about 30 seconds here before you go. What's the clearest message you can give to parents who may be watching if they're unsure whether their child is fully protected from measles?
Well, the way to gain protection from measles is through vaccination with the MMR vaccine. It's the best way for people to protect themselves. It's also the best way to stop ongoing transmission. If someone can't get infected, it means they also can't transmit. So that protects the people around them. That's what we call herd immunity. And this is a really, really good vaccine. And I would urge people to check their vaccination status for themselves or their kids and get vaccinated if they're not already.
Professor Ben Lopman, thanks so much for joining us this morning. We appreciate it.
My pleasure. Thank you.